Hello, this is BTA 600, week 6, case 7. So this week, the summary of the patient case is a patient who is 25 years old who sustained a traumatic brain injury and a right upper extremity shoulder disarticulation after a high-speed motor vehicle accident. At the scene, he did require CPR and had a brief period of an anoxic brain injury. His medical history does include depression, anxiety, and past drug use. Following the initial surgeries for the amputation and abdominal injuries, he had procedures for wound care and skin grafts. So in rehab, he presents with impaired cognition, poor motor planning, decreased balance, postural changes, and phantom limb pain. He currently does need minimal assistance for standing balance, transfers, ambulation, and stairs are unsafe at this time. The contextual factors of this case that may impact his recovery, for example, for personal, he is young, he's 25 years old, he does have previous full independence, so this can show that he has strong rehab potential, but due to the history of depression, past drug use, and anxiety, the recovery process may be slower and this may affect motivation. The environmental contextual factors of this case are that his home has 12 entry steps with a left handrail, which is a major barrier since he currently cannot use the stairs safely. For psychosocial, he is living with his mom, so she does provide that social support, but the loss of his dominant arm and the cognitive deficits may cause safety issues and frustration and may cause a strain on the relationship. For a socioeconomic contextual factor, he was employed full-time as a mechanic, and that is a physically demanding job. So that will be challenging to return to given the amputation and the cognitive changes. This may cause some financial stress and impact his long-term independence. For number 3, the recommendation for safety and accessibility, I would recommend some sort of stair lift at home or installing a ramp, so that way that eliminates that 12-step barrier since he cannot walk up the stairs right now independently. This will allow safe and access to him without the need for someone else to help. And as well as it helps reduce the risk of falls during the entry and exit of the home, but this can be a costly solution, so that is something to keep in mind. A local resource that I found that can be beneficial for this patient is called the Amputee Coalition. Now, this is a peer support program, and they provide educational materials, online and in-person support groups. So this can help people with living with their limb loss and for their families to adapt to the changes for the patient. Through the peer visitor program, this patient can connect with others who have experienced similar injuries, and this may improve his coping skills and provide use for his prosthetic and just reduce the overall feelings of isolation. So in summary, this patient's recovery will require a team approach that addresses not only his physical well-being, but his mental, emotional well-being as well. So by modifying his home environment for safety, connecting him with community resources like the Amputee Coalition, and involving his family in the rehab process to continue at home as well, we can help him regain that independence and to improve his quality of life.